1965 Orange Bowl marked the first primetime night game in Orange Bowl history as Texas upset top-ranked Alabama and game MVP Joe Namath, 21-17.
Well, I was recruited by several schools: Clemson, Georgia Tech, Florida State, Auburn, and Alabama. And I was really tempted to go to all of those schools, but when Coach Bryant came along and promised me a national championship ring if I came to Alabama, that pretty well sealed the deal for me. But we knew that we were a part of something big, and we just had so much confidence in him that if we followed his lead and did the things that he asked us to do, that we knew great things would happen. And indeed they did. During the 4 years I was there, Alabama won 2 national championships and then won the national championship the following year in 1965 as well. Probably the most talented players that I played with at Alabama were Ray Perkins and Joe Namath. Of all the games I played in at Alabama, the last one was probably the most memorable. We were behind, but we drove the ball down to the 6-inch line. We had 4th and goal on the 6-inch line with less than a minute to go in the game. And Joe called a quarterback sneak right behind me. And when the ball was snapped and the 2 lines clashed into each other, Namath crossed the goal line. And one of the officials took the ball away from him, raised his hands, called it a touchdown. And the head official came running in, grabbed the ball, took it away from this official, put it down on the 6-inch line and motioned first down Texas, overruled the touchdown. As we approached the sidelines, one of the players on our team said to Coach Bryant, "Coach, we scored." And I turned to look at him to see what his response would be. His response was this: if he had walked in, there'd be no question about it. Well, that's the lesson that I learned that night in the Orange Bowl on the goal line. If you want to accomplish something, don't do just enough to get the job done. Go beyond what is expected and leave no room for doubt.
And Dr. McCollough, what a wonderful story in the opening about your days at Alabama. Now, I want to know how you went from being an academic All-American center, snapping the football to Joe Namath, playing alongside Ray Perkins and such, to this international recognition that you've gotten as a surgeon and a writer and a speaker and just all-around fascinating person. How did you make the transition from college football to going to medical school?
Actually, it was pretty easy, Malia. Many people ask me, how does a football player become a surgeon? I always thought of myself as a surgeon working his way through college playing football. So football was never it for me. It was just a means to an end. As a matter of fact, I was drafted by the Dallas Cowboys and had an opportunity to go ahead and play professional football. But after thinking about my career in the future, I decided to go straight to medical school and forego career as a professional football player.
Now, you talked to me earlier about how Bear Bryant actually kind of guided you that direction as well.
Yeah, I had a conversation with Coach Bryant about that, and I asked him what he thought about it, and he said, "Look, Gaylon, there's no question, but you can play." He said, "But think about this. You've made an All-American team. You've played on a national championship team." And he said, he asked me a question that I had never considered. He said, "Can you live without football?" And I thought for just a moment, and I said, "Yes, sir, I think I can." And he says, "If you can live without football, my advice is to go ahead and get your medical degree and leave it behind." I thought it was good advice.
Excellent advice. You know, you mentioned to me as well that you started out thinking that you might want to go into architecture, but I guess there's not much difference between plastic surgery and architecture, is there?
Well, my dad was in the construction business. He was a plumber, and I worked on construction jobs, and the only man I ever saw come on the job that had on a white shirt and a tie was the architect. And so I decided that, well, maybe that's what I should be. And I'd always been artistically inclined. I used to draw a lot when I was a kid. And so I thought I was going to be an architect, and was recruited by Georgia Tech and actually committed to go to Georgia Tech and play football there. And then Coach Bryant came along and promised me the national championship ring. And so I decided to go to Alabama, but Alabama didn't have an architectural school. So I really went into medicine as a second choice. And I went through the traditional pre-med program. In my second year in medical school, I was already in medical school. We had a plastic surgeon come lecture to our class. And when I saw the before and afters, it was like turning a light on in a dark room. That's architectural medicine.
I have to say it's a little intimidating sitting here with you, because I feel like maybe he's looking at every aspect of my face thinking how he can fix it.
Nope, that's not what I'm doing right now.
Do you approach people that way? I mean, when you see people, I mean, I'm sure you get that a lot.
Well, first of all, I don't work all the time. So it's like a psychiatrist. If you can imagine, if you go to a party and you meet a psychiatrist, automatically you think, my goodness, he or she's going to analyze me here.
Right.
But they're not always working. And so I don't do that, really. Whenever somebody asks my opinion, then I will focus on those features and give them an honest recommendation. But it's not something that I analyze every face that's out there, and I'm working all the time.
Now, you started off your career in Birmingham.
That's correct.
In 1975, and I remember that because I'm also from Birmingham, Alabama. We chatted about that a little bit. Now, you were there for how long?
35 years I was in Birmingham. I practiced for 25 years. The first 10 years that I was there is where I did part of my training, my medical school and part of my residency. And then I went away from Birmingham for a year to Beverly Hills, California, and Boston, Massachusetts, and New Orleans to do my specialty training in facial plastic surgery. It was called a fellowship.
Okay.
And then I came back to Birmingham, and I was on the faculty at UAB for a while, and then I opened up my own clinic. And in the early 90s, a large medical conglomerate contacted me and proposed to buy my practice and my clinic there. And I laughed. I said, I don't think it's for sale. But after a couple of meetings, they put a proposal on the table that was very tempting, and so I took it. I sold everything and moved to the beach.
You've written several books, but one of the ones we're going to be focusing on in the next segment will be The Appearance Factor, which is actually a consumer's guide to facial plastic surgery. But the other one that's kind of intriguing to me is Let Us Make Man. What was your thought process there?
Well, it really dovetails into the last question. When I sold the clinic in Birmingham, I thought I was going to retire. I had a lot of time on my hands, and I decided to read the Bible again. And I'd read it many times, but I started reading the book of Genesis, and I only got to verse 26 before I stopped. And there was something that really struck me. And God said, let us make man in our own image, after our own likeness. As many times as I had read that verse, the words us and our had really never sunk in. And so I thought, well, let me try to determine who is us and who is our. Who did God turn to say, let us create mankind? So I spent 9 years researching this, and Let Us Make Man is it's a compilation really of my research.
And your thoughts.
And my thoughts.
Of course, you later came out with The Long Shadow of Coach Paul Bear Bryant. That was in 2008?
I think that's correct.
Okay. And why did you feel compelled to write that book?
Well, I waited 22 years before I wrote that book, but I could see that people were taking a lot of liberties with what Coach Bryant thought and what he said and who he was. There have been many, many books written about Coach Bryant, maybe 50 or more, but mine is the only book ever written about the man by someone who truly knew him. I wanted history to be recorded correctly, and so that's why I decided to write The Long Shadow of Coach Paul Bear Bryant.
Why does it matter what we look like on the outside? Why do you think that is?
Well, because first impressions count. First impressions are very, very important, and this has been recorded for thousands of years. As a matter of fact, Aristotle once said that a pleasing appearance is more important than any letter of introduction. If you think about that a little bit, let's say that you're going in to apply for a job, and in your hand you have a letter from a very prominent person who is recommending you for that job. What Aristotle said, and it's been documented ever since, was that the way you look when you walk in the door, the very first impression, is as important as what's in that letter, because you either have to overcome a negative impression or you have an opportunity to build upon a positive impression. And so I know it may not be politically correct about appearance, but appearance counts, and there's been a lot of research done on this.
Well, you know, we chatted about that early on, about the Newsweek article, and you mentioned that in your book, The Appearance Factor. Expound on that a little bit.
Well, it's been shown that better looking applicants for jobs are more apt to be hired if the qualifications are pretty equal. The way one looks is important because it opens the door of opportunity, and then you can slide through that door of opportunity and then you can prove yourself.
To order your copy of The Appearance Factor, call 866-876-7600 or go online to McColloughPlasticSurgery.com.
So it's not all about vanity or being vain and wanting to look better than anyone else, would you say? It's about presenting your own best image and presenting that out to the world.
I think it's a matter of personal pride. The word vanity is oftentimes misunderstood. To me, vanity describes a person who is so obsessed with his or her appearance that it interferes with their ability to go about their normal activities. But if one gets up in the morning and takes a bath and combs his or her hair, and in a woman's case puts makeup on and puts the right accessories with that and coordinates his or her clothes, and they go out and present a good image, that's really a matter of personal pride. That has nothing to do with vanity. And I think there's a biblical basis for this. In Luke, we're told, to whom much is given, much is required. And so if we are truly made in the image of God, as we say we are, then I think we have a responsibility to that image to make sure that it's presented in the best manner that it can be.
And right behind that would be your body as a temple for God.
The body is the temple. And then think about this. If the temple walls start falling down and cracking and the ceiling starts falling down, what do you do with it?
Paint it, repair
you fix it.
Or fix it.
You fix it. So then why shouldn't we do the same thing with our bodies? If we have the ability to improve the way we look and our health, then I think it's an obligation for us.
What questions, just briefly, should every patient ask a surgeon before they think about having plastic surgery?
Well, let's back up just a little bit. When one goes to see a doctor, the doctor is going to interview the patient, but I think the patient should take the approach that I'm here to interview my doctor as well. And it's my body, and I have the right to ask any question that I want to know, and I have the right to be told the answers to those questions fairly and honestly. So the things that I think you ought to ask, and it's regardless of whether you are contemplating plastic surgery or any procedure, you ask the doctor, tell me this, doctor, about your qualifications and your training. How many of the procedures that you're recommending for me have you done in your career? How many do you do in the average week or in the average month? Is this your specialty, or is this something that you do periodically or randomly? You also have a right to know who's going to be doing a procedure. Are you going to be doing the operation, or is one of your assistants going to be participating in it, or perhaps even doing the procedure under your supervision?
Does that happen pretty frequently, Dr. McCollough?
Happens in training programs quite a bit, because quite frankly that's the way that a lot of young doctors learn to do the surgeries. And the larger the institution, generally the more apt one is to have a trainee do more of the surgery. Now, we have a very strong policy here in my clinic that whoever the patient contracts with to do the surgery does the surgery.
So if I do a consultation with you, I know you are going to be doing my surgery.
If you choose for me to do the surgery, I'll be your surgeon. Now, if you choose for one of the other doctors to do the surgery, that doctor is going to do the surgery. So, and sometimes we combine it. Sometimes we do a facial procedure at the same time that we do a body procedure, and it saves the patient money and recovery time as well. So, but here in our clinic, the patient knows which doctor is going to be doing which procedure. There's never any question about that. You also want to ask the doctor, what if a problem occurs? Who's going to take care of the problem? Are you qualified to take care of the problem that might occur, or are you going to have to send me to another doctor? And if that's the case, who's going to pay for the corrective surgery if it's required? Are you going to take care of it, or am I going to be responsible for it? These are all questions that you really need to have the answer to. Ask about board certification. Board certification is important, but I can tell you that a plaque hung on a doctor's wall really only means that he or she has completed a specified course of study. It does not mean that he or she is totally competent in doing the procedures that you are contemplating. So you need to ask these tough questions.
Tough and critical questions. All very good questions, and we'll be right back. But first, we're going to take a look at what has driven Dr. McCollough's strong architectural and plastic surgery skills and blended those skills with his love of Coach Paul Bear Bryant. We'll be right back. Stay with us.
In the early 1990s, I was president of the Alabama Sports Hall of Fame. And we commissioned a sculptor in Colorado to do a large sculpture of Coach Bryant and Coach Jordan and an anonymous football player to be housed or to be placed right outside the Alabama Sports Hall of Fame Museum in Birmingham. We got a call from the sculptor several weeks after he had begun the project, and he was making a clay model of the large sculpture. And he said, I have Coach Jordan and I've got the anonymous football player, but he said, I'm having a very difficult time with Coach Bryant's face. And he said, could you send someone out here to help me with his face? Well, when that request came in, the board looked directly at me and said, nobody knows his face any better than you do, because it's not a secret. I had done some surgery on Coach Bryant the last couple of years of his life. So we flew out to Colorado and we went into the man's studio, the sculptor's studio. And when I looked at the Coach Bryant's face, it was clear to me that he was having difficulty because he couldn't decide at what age he wanted to capture him. So he and I looked at a group of photographs, and then after a while we were both on the ladder and I was putting clay on the face and scraping off, and we were both working together on the face. So he had the large sculpture cast, and then he also did 3 busts of Coach Bryant, and he also did 3 busts of Coach Jordan. 2 of those busts are in museums. One is at the University of Alabama, and the other is in the Alabama Sports Hall of Fame inside. He said to me, I want you to have the 3rd one because you helped me with the project. And so I have it here in my office, and it's a treasure. It's not something that I display openly here in my clinic, but it's here in the office so that I can see it every day, and it has a very special meaning to me.
What a fascinating story about the sculpture of Coach Paul Bear Bryant as it looms right behind you. It's a beautiful masterpiece. I bet you have some wonderful memories from helping construct that sculpture.
I do, and I was really honored to be asked to be a part of it. Because it was one final thing that I could do for him, because I wanted not only his memories to be captured as they really occurred, and that's why I wrote the book, The Long Shadow of Coach Paul Bear Bryant, but the sculpture was the last sculpture made of him. And it's important to me that it reflect his face and his character.
You obviously spent so much time with him that you knew in 3-dimensional what he would look like, and I guess that's something that you can't just pull off of a photograph if you're an artist.
No, you can't. And one of the challenges that a sculptor has whenever he or she begins to create a sculpture is that at what age does one capture that individual? Is it at the end of life, or is it the prime of life, or is it somewhere in between? And what we chose to do was to take him back about 8 or 10 years before he passed away.
Right.
When he was breaking the record and things were really at the highlight of his career.
How important is it, Dr. McCollough, to really get to know your patients and know what they like to do and their lifestyles and where they stand emotionally in life?
Well, I think it's critical, because you really have to know the motivation behind why a person is coming to see a surgeon and why that individual wants to change his or her appearance. Because everybody has a reason for it, and that reason may not necessarily be the same for every person that comes in. So I really feel strongly about personalizing the treatment plan. And you cannot personalize a treatment plan unless you get to know the individual. I probably spend more time with my patients prior to surgery, and I know I spend more time with them after surgery because, quite frankly, I like them. They become dear friends. I like the fact that I can look at my daily schedule and say, oh my goodness, here come 10 or 12 of my best friends in today.
Right.
And that's what keeps me coming to work every day. You know, I'm working now because I love it, not because I have to, but
right.
because I love what I'm doing. I can't think of anywhere else in the world I'd rather go in the morning than to get up and come over here and work at my clinic.
What are some of the best reasons to have plastic surgery?
Well, the best reason is so that when you look in a mirror, that the face you see staring back to you is exactly how you feel inside. I hear this all the time, that a person says, you know, I feel really good. I've got a lot of energy and I feel really good about myself. And then I go to the mirror and I see that old person staring back at me.
I look like my mother or my father.
Exactly. So what we try to do is to bring those two selves as closely as we can together so that you look as good as you feel. And that's also why it's so important, in my opinion, to look at the entire person, the total person. You know, and the name of our institute here is the Institute for Appearance and Health, because I don't think you can really separate those things. And here's something that I have learned in my career, that individuals who do the things that are required to look their best find better health, even if finding better health might not have been the motivation that sent them to the doctor in the first place. Now think about that, because if you watch your weight, and you work out and you look fit, it may be that appearance is the reason you're doing those things, but look at the side benefits. You're also becoming healthier as you do those things, as you pay attention to what you eat, as you exercise, and the cardio and the aerobics, all of those things. It's really impossible to separate appearance and health.
Tell me where your patients come from. You had mentioned that to me before. About a third of your patients come from the local area?
Yes, if you were to look at, well, a point on the map, Gulf Shores, and then you've got the Gulf here and you've got the mainland up here. If you draw a 60-mile radius from Gulf Shores, about a third of our patients come from that area. And that includes, of course, Mobile and Pensacola in that region. And then if you go another 300 miles out, another third come from there. That's New Orleans, Jackson, Mississippi, Birmingham, Atlanta, and even Tallahassee. And then the rest of them, the other third, really come from the world. You know, I take the approach, when I go to these countries, I could do a dozen cases and help 12 people, or I could teach 12 surgeons and help many people for years to come. Once again, it's the old adage that give a man a fish and he'll have a good meal. Teach a man how to fish and he'll have many good meals for the rest of his life. So if I can share the things that I know and teach the things that I know and have experienced to doctors worldwide, then I can help more people by doing that. And as I do those things, as I teach those techniques, many of the doctors themselves decide that they would like to have some surgery, or their family members would, or if they have a patient who comes in, they will send them here.
Now, what about males versus females? I asked you this question earlier, and you said about 30% of your patients.
Today, it's about a third of the patients who come for plastic surgery are men. Now, when I first started in practice some years ago, it was only about 5%.
Wow.
But the number of males seeking plastic surgery seems to be on the rise, and that number is increasing all the time. Interestingly enough, during recessions, you would think that the demand for plastic surgery goes down. But whenever we talked earlier about the fact that the way one looks when they walk in for a job application is important. And so people are realizing that if I'm going to really get back into the job market, I've got to put my best face forward. And so many people will actually invest in having plastic surgery to make them look fresher and more youthful and more fit.
And more rested.
And more rested to go out into the job market.
And to tackle the job market. Well, you know, that makes sense. And today we see ads across the television, magazines, about all of the commercialized procedures. And we won't name any of those, but you and I chatted about this.
Yes.
You know, they're the little downtime, 2 days and you're back at work. Tell me what your thoughts are on those commercialized procedures.
Well, there's no question but there's some improvement. You can definitely get some improvement with minimal type procedures. But unfortunately, there's a lot of what is known in all of the industry as bait and switch, where they'll be promoting a minimalist type procedure, but the results they show are someone who's had multiple procedures done.
Right.
So the person thinks that if I get the procedure that's being advertised, I'm going to look like that. But if you read the fine print, you'll see that they've done many, many more things to the face. Now, it's been shown that if you do minimal surgery, you generally get minimal results. And so if you're looking for long-term results, you really have to do more surgery. And there's a gimmick in the industry right now about short scar facelift surgery.
What's that?
Well, it means that it's an incomplete facelift is really what it means. It's less than a complete facelift, but the results are also short-lived. And so the patient thinks that they're getting a traditional facelift just done through a different technique, but they aren't. And this is it's so important to ask those questions that you and I talked about earlier. And like if a doctor is going to recommend a certain procedure, and if it's promoted as a minimal procedure, tell me now, how does this compare with a real facelift? And what are the results going to be? And how long is it going to last? And when might I need a tuck-up procedure or additional surgery? Because we see it all the time. People go in and have some of the commercially advertised minimal type of procedures, and 6 months later they're here in our office. And these are their words, not mine. I wasted my money. I spent all the money over there. I didn't get the result. Now I've got to come and have a real facelift done.
To correct what wasn't corrected before?
Well, not necessarily to correct it, but to complete it. Because remember what I said earlier, these minimal procedures are incomplete procedures. You're not getting, for example, with a facelift, one has to do some fat removal if there's fatty tissue here and here.
Right.
You got to do some liposuction. Then you have to tighten all the muscles in the neck and all the muscles in the face and the muscles in the brow. Then you remove the loose skin. And unless all three of those components are done, it's an incomplete procedure. And many of the less expensive procedures that one gets are the shorter incisions. Don't address all of those things. But the public doesn't know that.
Right.
They think that they're getting just a little different twist on the procedure.
And all they look at is those before and after pictures. They see this is what she looked like.
Very impressive. The photographs are very impressive. Now, there are two things that you want to ask about photographs. First of all, how long postoperatively are these pictures? Because it really doesn't matter what kind of facelift one does. You're going to look pretty good in 3 or 4 months. But now, how good are you going to look in 3 or 4 years? That's what's going to be important.
What do you think about injectables? A lot of folks out there are doing the injectables here and around the mouth and this fold area where we all get that extra little line.
I think everything has its place. I think the injectables are really, really good if a person has, let's say, a class reunion coming up next month, and they don't have time to have surgery. You can have a temporary correction of those problems by having some of the deep creases filled in with an injectable. It's a temporary injectable. It may last 8 or 10 months, but it's all going to go away in time.
Right.
Or let's say that one gets the wrinkles around their eyes or up here in their forehead, then you can have some Botox put in, and that's going to help you for a few months. But unfortunately what's happening today is that many people are thinking that these are substitutes for surgery. And I can just have these things done for the rest of my life and never have to have surgery. But if you start looking at the economics of that, it gets to be pretty impressive if you look at what it costs per injection. And then you've got to have that done 2 or 3 times a year.
Right.
And then if you look at that over a 5-year period, you will have spent thousands more dollars in trying to avoid surgery than you would have spent if you had had a real procedure done.
I gave some thought to that, and I have had friends who've done the injectables, and they say $1,500, $1,200, $1,500 and
per treatment.
Per treatment.
Now do that 3 times a year.
Right.
And let's just use round numbers. Let's say $5,000 a year, and you do that for 5 years.
Wow.
You've invested $25,000 in injectables, and you have absolutely nothing to show for it because when the last little bit of injectable goes away, you're right back where you were.
Right.
But had you had, and it's not going to cost you $25,000 to have a facelift and eyelids and the whole ball of wax is not going to cost you that.
Right.
And that's going to last you for life because you'll always appear younger than had you not had the surgery. So when you start looking at it from a purely economic standpoint, injectables are designed to be short-term corrections. And if you look at it in that manner, then it's great. I love it. We provide it here in the Institute. But it's not done as a substitute for more definitive type of surgeries and treatments.
Enhance and rejuvenate at the McCollough Medical Spa, the Wellness and Rejuvenation Center at the McCollough Institute. The McCollough System of Rejuvenology uses an integrative approach to enhance surgical results by blending non-surgical treatments to achieve a more balanced and beautiful you. Recapture the glow and inner radiance of your skin at any age with a variety of deep cleansing or soothing facials. Go a little deeper with microdermabrasion, IPL, or laser treatments. Soften frown lines with Botox. Add fullness with Perlane, Restylane, and Juvederm injectables. Unlike traditional day spas, the new McCollough Medical Spa can also assist you with weight management, nutrition analysis, and hormone testing. A synergistic approach to health and balanced beauty awaits at the McCollough Medical Spa, the ideal place for relaxing and rejuvenating the mind, face, and body, right here on the Gulf Coast in Gulf Shores, Alabama.
Dr. McCollough, define for me the McCollough facelifting system that you've trademarked.
Well, it divides the population in general into 5 classes, stage 1 through stage 5. Stage 1 is somewhere we would consider the 30-something lift. And it's really not a lift at all. It's more of a contouring procedure where we go in with liposuction, remove the fatty tissue under the chin and along the jaw lines so that the skin just simply conforms to a new foundation underneath. And, and because it has good elasticity, you do get a little bit of a lifting, tightening procedure with that. Now the 40-something facelift is one that really is a partial lift. It's predominantly the eyebrow that's beginning to droop and maybe a little bit of drooping in the upper cheek, but the neck is usually okay in the 40-something lift. So it's a partial lift, usually a temple or brow and cheek lift.
Okay.
Now then you move on into the 50-something lift, and that includes the neck, the cheek, the temple, brow, and sometimes the forehead when the wrinkles in here between the eyebrows begin to show up.
So you can do a brow lift without doing the whole forehead lift then?
Absolutely.
Okay.
You can make an incision here behind the hair and just simply lift the outer brow. And then the forehead lift lifts this part.
Okay.
And the way we do the procedure to keep from moving the hairline up is that I make the incision right at the edge of the hairline, and it's done in such a manner that the hair actually grows right through the scar. So it's almost impossible to see the scar. And that's the way to keep the hairline in a good position, because many times if you're, let's say you're starting in your 40s and you have a procedure done and 10 or 15 years later you want a little tuck up done, if you continue, or if the surgeon continues to go behind the hairline with each procedure, he's moving the hairline up. And by coming right at the edge of the hairline, you can avoid ever moving the hairline, and we can make those incisions in such a manner now that they're almost imperceptible. They're hard to find because the hair actually grows right through the scar.
Well, let's talk about the incisions. Where typically are the incisions for these procedures that you're discussing?
Well, let's actually look at one of the photographs that we have here that demonstrates where these incisions are.
Okay.
The important thing to note is that the incisions for the brow lift are really all behind the hair. The ones for the cheek part of the lift follow the natural contours and creases in front of the ear and right where the ear and the face meet. And then the incision for the neck lift comes right under the earlobe, goes up and behind the ear, and then turns and follows the edge of the hairline behind. And then the one for the forehead, of course, as I mentioned, is right at the edge of the hairline. Now, if a person has a really low hairline to begin with, it's okay to raise it up a little bit, but you just don't want to continue raising those hairlines up until you get a really high forehead or something that starts looking, again, unnatural or abnormal. Everything that I do is designed to try to preserve what looks natural.
You told me something kind of funny about men. Men approach plastic surgery and facelifts a little differently. Tell me that if you don't mind.
Well, many of us men we just can't come to grips with the fact that we have a facelift. Now, it's okay to have your neck done.
Right.
So if you can have the neck procedure done, but then you slip up in here in front of the ear and in those creases, and you can also help the cheek just a little bit too. And if the brow's a little bit low, you can have a little bit of a lift of the brow. As long as you don't call it a facelift,
right,
it's okay.
And it's just a neck lift. I just had a little neck procedure
Just a neck lift. And then there's another procedure that we do rarely, but it's still possible for the person, let's say, that's not in good health and really couldn't withgo a full neck lift. We can make an incision right here and just literally take that little waddle of skin out like I need right now Just take that little waddle of skin out and make an incision right there.
Oh, wow.
And it's a
Okay.
more direct, it's called a direct excision of skin. And that's a very effective way if that's all that concerns the person. So some of the questions that we talked about earlier I think are really crucial. As one is looking into whatever procedure it is, whether it's a commercialized procedure or whether it's one that you're going to see a doctor in your own community. You just want to know, what is it that I'm getting? What is it that I'm paying for? You know, help me understand this so that at least I know what I'm getting. If you'll notice, in the 50-something lift, the neck becomes more of an issue. And so it's crucial that not only do we tighten the skin and remove the loose skin, but that we also address the muscles. And we tighten the muscles in the neck, and sometimes liposuction needs to be done. Maybe not a lot, but oftentimes we have a little tiny waddle right under the chin that needs to be removed. But also you can see that the cheeks are lifted and the brows are lifted, and oftentimes once we get into our 50s we begin to see wrinkling around the mouth or at the corners of the eyes, and one of the resurfacing procedures needs to be done at that time, in either a peel, a chemical peel, or a dermabrasion, or perhaps a laser. And then if you move on up to the class 5, these are the 60 plus, anywhere from 60 to, believe it or not, 85. But once you get into that age group, now wrinkles become more of an issue. And they're not just around the mouth or around the eyes, but they're really all over the face. And you will see that in these photographs, we have a lady that had the muscle bands in her neck tightened up, and she also had the cheek lift and had the brow lift, and we did her upper and lower eyelids. But then she had a full face resurfacing. And we did the entire face at a separate sitting. She came back 9 months later and we did a full face resurfacing, a combination of chemical peeling and dermabrasion, and you can see the smoothness that she got in her skin. We oftentimes consider these resurfacing procedures as the icing on the cake, and you get a number of benefits from the resurfacing procedures. Not only does it eliminate somewhere around 90 or 95% of the wrinkles, you also get additional skin tightening, which makes the facelift more effective for a longer period of time. And the third thing that happens is that usually patients with deep wrinkles have a lot of sun damage and are more prone to develop skin cancers. So these resurfacing procedures also help prevent the occurrence of skin cancers.
When you say resurfacing, what does that entail? Is it a chemical peel or is it some sort of a laser? What is it?
Can be either.
Okay.
There are 3 ways to resurface the skin. One is a chemical peel, one is dermabrasion, and one is laser. Now, in each of those procedures, one can do what I call a level 1, level 2, or level 3. And a simple way to look at it is a superficial, a medium, or a deep treatment. You can do a superficial, medium, or deep peel. You can do a superficial, medium, or deep dermabrasion. You can do a superficial, medium, or deep laser. It is the depth of the injury that determines the outcome of the operation. And unless it takes you 2 weeks to heal from either of these procedures, whether it's a chemical peel, a dermabrasion, or a laser, you're not going to get any long-term benefits. You have to invest a couple of weeks if you're going to expect it.
You said something to me that there's always an exchange. What do you mean by that?
Nothing in life is free. You exchange one thing for another. And with surgery, we exchange less skin, less droops, less sags for incisions. With the resurfacing procedures, you exchange fewer wrinkles for maybe a little different color in the texture and the color of the skin. Oftentimes the skin is just a shade lighter after you've done one of these deeper procedures that gets rid of wrinkles. So it won't ever be exactly the same color, but it'll be maybe one shade lighter in color. So everything is an exchange, and you just have to decide if you want to have that exchange made. Probably the best example, we talked earlier about something called short scar facelift, where the incision is made just down to the bottom of the earlobe. Well, you exchange no scar from behind the ear for leaving behind sometimes as much as 5 or 6 inches of skin in the neck. So that's the exchange. If you want the loose skin in the neck removed, you exchange that for a little incision that runs down the back.
Right.
That's what I'm saying. Nothing is free. It's all an exchange.
So it's about a realistic expectation of giving one thing up or losing one thing, one negative thing, and maybe gaining something that's not quite as negative.
Correct.
Like a small scar.
Well stated.
We are Denise and Nelson Wellman, and we live here in Gulf Breeze.
And what we love about living here on the Gulf Coast is the water, the sun, the atmosphere, the people, the friends that we've made, the easygoing lifestyle. It's the best.
We go boating a lot, so we'd like to do that. We go kayaking, that's good. I go on the motorcycle with him occasionally, but we like to do that some, but that takes us away from the house.
What made us decide to look into plastic surgery was my eyes were starting to, in Dr. McCollough's words, hood, which means they're closing and cutting out my vision. And he said he could perform those functions on my eyes and make me look, feel, and see so much better. And then we talked a little bit more and we said, while we're at it, maybe we might do this and we might do that. And then...
Well, we got so comfortable talking to him, and he made it sound like, well, this is not a difficult task to do some of this. It's not, when you have confidence in someone, it all of a sudden isn't as scary. The more I talked to him, and we had gone through a very stressful thing in our life with losing our house with the hurricane, and all of a sudden you start going, I feel really good, I am healthy, I haven't had any problem, and all of a sudden you look in the mirror and you go, oops, what happened? Things are moving down really fast. He is truly, truly, truly one of those wonderful surgeons that also believes in the golden rule about doing unto others as you would have them do unto you.
Don't expect to look like a different person. Just expect to look better. And in my case, a little bit younger. And I could see better. And he was exactly right. It was funny because a lot of my friends said, wow, you look like you lost weight. You look so much better than you did before. You know, you're happier. And all it was is I just looked a little different. And the main thing is I felt different.
I've spent all my life, I was an aerobic instructor, I've done exercising, I've eaten properly, I've done everything that I can possibly do, and it has paid off. Everything else was going great, and then all of a sudden I realized, you know, I did look tired. People were saying, are you tired? Are you tired? And you get kind of tired of hearing, are you tired? Once it was done, I realized then it wasn't that I was looking for responses from other people. It was my total inward response every time I looked in a mirror. I was just like, now I look like I feel. I do. I feel great and I'm looking good.
Dr. McCollough, the Wellmans were a joy. What does it mean to you when you see these wonderfully young, vibrant people come to you? They're a little older in age, but they feel like they're 35 years old. You know, and they come in and they want to look like they feel on the inside. That's one of the things that Denise said to us.
Well, that's what keeps me coming to work every day, is to get a chance to work with people like the Wellmans. I get to know them and I know about their personal lives, their children, their grandchildren, their hobbies, and I think it's important that you know that the doctor knows about those things because it helps you understand their motivation for having the procedures and what you might do to help develop a long-range treatment plan, not only for the procedures that you've performed right now, but what they might need or what they might request in the future.
Now, Dr. McCollough, educating your patient seems to be at the forefront of your surgical practice.
Yes, I think that the more a person knows about anything, the better decisions that they're going to make. And the better decisions they make, the more apt they are to be happy with the results of the surgery afterwards. That's why we provide the book, and we spend a great deal of time in the consultation going over all of their concerns and questions. And as I mentioned, I try to demonstrate to them what I think is achievable, but I also want to make sure that they understand what the surgeries cannot achieve.
Right.
And that way you're going to have happy patients, and
Sure.
like the Wellmans, they'll come back for a long period of time, and we see them frequently and see them for a long time. I've got patients that I operated on 30 years ago that are still coming back to see me from time to time, just for questions or just for checkups. I love to see them when they come in.
Oh, I bet. I bet. What do you find when you see someone who's had the surgery? Do you see, I mean, I'm assuming great results still. When someone might need a little mini tuck, what would that entail?
Well, once we've done the surgery, if you do one of the operations that I've talked about doing, not one of the little commercial lifts or not a mini lift on the front end.
Right.
Now, mini lifts have their place, but mini lifts have their place after you've done the foundation work. And so once you've done the initial tightening of the muscles, once you've done the initial liposuction and removal of the skin, then as the years go by and the aging process continues and you begin to see a little bit of slack here and there, at that point we can make small incisions and we can do minimal surgery just to do little, what I call spot welding, without having to do the whole procedure again. And that falls into the maintenance category. You know, we talked about preventative maintenance versus a total rejuvenation package.
So make sure not to get the cart before the horse. So
you don't do the mini procedures on the front end. The mini procedure should be done after you've done a real facelift or real blepharoplasty or real peel or dermabrasion.
To order your copy of The Appearance Factor, call 866-876-7600 or go online to McColloughPlasticSurgery.com.
Proportional beauty, what does that mean?
Leonardo da Vinci actually did a lot of study on the human body. And many people might remember the drawing, the Vitruvian Man, with the man spread out in the circles and the squares around there. But da Vinci also did a great deal of work around the face. And we're going to look at a slide here that will show what da Vinci taught us all. He is the plastic surgeon's architect, so to speak. It shows that if you draw a line at the hairline, a horizontal line at the hairline, and you draw another line through the eyebrows, another line through the base of the nose from side to side, and one at the bottom of the chin, all the way across. Those lines should divide a face into equal thirds in the vertical or up-down dimension. He also showed that if you measure the width of an eye, you should be able to put another eye directly between the two. And that if you connect those lines, that the nose should fit inside that rectangle. If the nose is outside that rectangle, if it's either too wide or too long, it's out of proportion. And you can do the procedures to bring the nose back into proportion. Beauty is harmony. Any feature that's out of proportion will detract from one's beauty. And if you have one feature that's out of proportion, then that's a problem. But if you have more than one that's out of proportion, the more those things you bring into proportion, the more you start accomplishing what we think is the beautiful face or the handsome face. From the side view, if you extend a line straight down from the lip, the chin should project almost to that point. A strong chin is a masculine characteristic. A receding chin is a feminine characteristic. So if you have a woman with a very prominent chin, you can soften her facial features by reducing the projection or the size of her chin. Conversely, if you have a man with a receding chin, you can make him look a little more masculine and macho by bringing the chin forward with an implant, chin implant. Same thing is true with the cheeks. And then if you look at the nose, a man's nose should have a very slight, just a very slight hump on it. And the angle between the lip and the nose should be 95 degrees in a man. In a woman, it should be 105 degrees. So you see there's a little more up tilt to the feminine nose than there is to the masculine nose. And then if you look at the lips, let's talk about that a little bit. We discussed earlier something about the lips. If you draw a line between the upper lip and the lower lip, that line should occupy 1/3 of that lower box. And the upper lip should always be slightly smaller than the lower lip.
Can you do the same thing from a photograph, just a straight-on photograph?
We do it all the time.
Okay.
We have patients from all over the world who send photographs to us. I can look at the photographs, and then what I do is give them some general recommendations.
Right.
And some options of procedures that they might consider. And then sometimes I'll get on the telephone and I talk with them, or we do Skype consults. So anybody that's interested in doing that, we can set up a Skype consult or send me photographs, and there's no charge for these evaluations. And I can generally look at the photographs and tell one what they might need to consider. We wait until I see you firsthand to finalize the treatment plan, because oftentimes photographs don't tell the whole story, but at least one can have a pretty good idea. We have a lot of patients who fly in here from far away already having surgery scheduled, but they understand that I'll see them the day before or the morning of surgery, and we'll finalize that plan on that morning.
You have 32,000, I think, if I read it correctly, square feet of a beautiful personal enhancement facility here, right in the middle of a golf course in Gulf Shores. And you're really dedicated here at your practice at the McCollough Institute to cater to the whole person from the beginning to the end. Walk us through what happens after the consultation and before the patient goes home.
Well, first of all, I've never liked the idea of drive-by surgery. To operate on a person, send them home, put them in a car, send them home with someone who really has no clue of what to do if a problem arises, and expect them to be cared for appropriately, I think is a stretch. And so for that reason, since the very first year I've been in practice, my clinics in Birmingham as well as the clinic that I had here, we've always had on-site facilities where patients can stay. And I cannot require, but I strongly, strongly recommend that everyone spend at least the first evening right here on site in one of our villas that we have here for patients with a trained caregiver. This is someone who is trained to take care of patients who've had the same procedures that this patient has had. And if the patient is here on site, we can come to them, we can get to them, we know where they are, and I think patients get much better care if they aren't just sent out, usually without printed instructions in many cases, and sent out on their own to take care of themselves.
How long is the typical recovery period? Say if you're 50-something and you have a level 3 or 4 facelift.
Well, let's look at different procedures because it varies by procedure, from just a few days to 2 or 3 weeks, depending on the procedures. Now, here's the kicker. Sometimes we do multiple procedures. It is possible to do every one of those operations that I mentioned to you on the same patient at the same day. A nose, eyelids, facelift, and some chemical peeling. And there are good reasons to do that. Number one, it's more economical because you only have one operating room cost, one anesthesia cost, one villa cost, one sitter, caregiver, so you can concentrate that. And let's say it takes 2.5 weeks to recover from a peel procedure. Well, the nose is a week, the eyelids are a week, and the facelift is 2 weeks, so by the time you're well from one, you're well from all. We also have the ability here, we have a doctor who does the body procedures. So we frequently do combined procedures where I'll be working on the face and one of my associates doing a breast procedure or a tummy tuck or a body liposuction. And we can condense that and do all of that at one time. And we always are careful not to do too much on the patient at one time. You know, we have a time limit that we won't go beyond in an outpatient setting like we are. But it's really very convenient for patients sometimes to have these multiple procedures done. So it saves them money and also saves them in recovery time.
Now, can they stay here? Do patients often stay here for that full 2.5 week recovery time?
We have patients who come from out of the country or who come from far away, or just someone who wants to hide and doesn't want to go home.
Doesn't want to be seen in public.
They expect their neighbors to show up with a casserole just because they're curious sometimes. But yes, we have patients that will stay a week or 2 weeks, or we've actually had some patients stay as long as 3 weeks here. And we can do that. We can accommodate them. We can provide food for them. It's one of the restaurants right here in the area. It's like room service. They deliver the food right to the door. If I were the patient, how would I want to be cared for? And what would I want to be provided for me or my family member? And that's what we try to provide for our patients. So yes, I think we do go a little bit above and beyond what one might get in many plastic surgery centers. We see the patients frequently in the early postoperative period. For example, if the patient's here, I see them every day, and then one of my staff sees them that night. We'll round on them twice a day. And then if they live in the area, I like to see them about every other day for the first week if they want to come. They don't have to, but it's their choice. And then let's say in 2 weeks or so, they're pretty well healed from the procedure. And then I like to see them at a month, 3 months, 6 months, and a year. And I'm monitoring their recovery. Patients have questions, after surgery. Everybody does. And even though we provide them with a book, and I actually have a CD that I give to the patients on the morning after surgery that talks about the healing process. And it just covers the overall aspect of healing, and there's a little bit of philosophy in there and a little bit of pep talk, and it's my voice reassuring them during this period of time. That's another thing that we think is a little bit higher level of care. But I think it's important that the patient feel comfortable about coming back to see the doctor and to ask the question and not feel that the doctor's offended by the questions that are being asked. The patient's concerned.
Sure.
If they weren't concerned about this little bit of swelling here or this little bit of redness over here, they wouldn't be wanting to come in. And we never try to embarrass a patient by asking a valid question. And so the other thing we do, the patients who live far away, we either Skype them in or they'll send photographs to me.
Yeah, is this normal?
I can evaluate the photographs and tell them whether or not they have a concern or not, is something not to worry about. And it just allows them to feel like they're constantly connected to us and that link or that chain is never broken. I never discharge a patient. A lot of times the doctor will say, "You're discharged." Well, no, you're not discharged. From me, I want you to come back as often as you need, but we suggest that patients particularly who are having aging face type surgery, every year or so, come back. Let's just look at you. I jokingly say it's like giving you a 50,000-mile checkup. You might not need your oil filters changed or your tires rotated, but if you do, then we'll talk about doing that.
At least come and see the mechanic.
Yes, that's right. Come and see what needs to be done. And patients are never charged for post-op visits when they become a patient of mine.
You know, this all comes full circle, and it reminds me of what you mentioned to us earlier, and that was lesson number 46 by the legendary Coach Bear Bryant. Why don't you tell the folks out there what that lesson was?
Well, we talked about it a little bit earlier, but it's the lesson that I learned on the last play of the last game that I ever played for the University of Alabama. And it was, if you want to accomplish something in life, don't do just enough to get the job done. Go beyond what is expected and leave no room for doubt. And I think that's the reason that we always try to do a little bit more. You know, I'm big on lanyards. I didn't know what the term meant till I moved down here on the Gulf Coast, but it means that little something extra.
A little something extra.
And we always try to throw in a little something that the patient didn't expect. Give them a little bit more than they think that they paid for.
Dr. McCollough, it's been a pleasure talking with you today. And if you're out there and you feel like the person who's on the inside of you is not who is being reflected back to you in the mirror, pick up the phone and give Dr. McCollough's office a call or go online to McColloughPlasticSurgery.com. Thanks for joining us, and I'm Malia Allen.
For your free e-consultation or more information about the McCollough Plastic Surgery Clinic at the world-class McCollough Institute in beautiful Gulf Shores, Alabama, simply go online to McColloughPlasticSurgery.com and download your free copy of Dr. McCollough's book, The Appearance Factor, or call 1-866-876-7600 and request your free copy of the Ultimate Consumer Information Guide to Becoming a Better You.